I jokingly always call internal medicine the area of fine print, because there's always a case that is like the exception, or hey, usually it's X, Y, or Z, but in actuality, we can also have this whole variety of other things occur. I'm stubborn, so I usually like to look in and investigate things. I don't like simple answers.
I have seen patients look like they truly are struggling, and the right medication, or maybe even just like a tweak in their medication or diagnosis, has like brought them back to life. And then you get to see them coming in and wagging their tail. They are just so humbling in the sense of you don't know it all, and you don't know the outcome, and you don't realize how resilient they are. I work in the internal medicine department at BluePearl. We specialize pretty much in the unknown cases.
Typically, we'll look at immune-mediated diseases or endocrine diseases, like if you have a diabetic patient or a patient with like high or low thyroid levels. We basically have all of the organ systems that are involved with internal med.
I think we almost go on that journey with them, because a lot of times it takes multiple appointments or diagnosis or testing to find the diagnosis.
Our clients come to us and they have exhausted other options. And, we've had already a very thorough workup, but it's like, what is the one last thing that we can try? So being able to offer that to clients is also something that's nice about my field.
The tools and the diagnostics that we get to do and run of the advanced imaging help us get to the next step. So it's very exciting. We get to do scopes. So endoscopy, rhinoscopy, retroflexing. We have ultrasound capabilities. We do CTs along with just your regular x-rays and things like that. But just that very advanced diagnostic tools truly do make a huge difference.
Internal med, encompasses everything in the body. Sometimes we'll often be kind of the gatekeepers maybe to neurology or oncology. It's great because then I can very quickly talk to my colleague that literally sits right next to me and say, hey, what are the chances that this patient would do well with chemo, or what kind of chemo options might you talk to about with this owner, so that I can kind of preface that, and then we can get them onto your schedule, and then you can, have them come to you for the long-term follow-up. So it does make things very smooth.
One of the best things about working here specifically is the fact that your coworkers actually are in your best interest. I think that plays a part in being able to actually learn in a positive setting. And if you can learn something from somebody else that actually makes a difference in patient care, that's everything.
One of the most rewarding things with working with clients is that we already know that their pet is sick, and we're trying to find a way to make them have a good quality of life and potentially a longer duration of time with us. And I often feel like we are able to give that to them. Basically, all of our clients are a big team effort. The owner's taking care of them at home and us taking care of them in hospitals.
You actually develop a relationship with those patients. So actually seeing where they are when we first meet them, and then say we find a diagnosis and we start treating them and we see them getting so much better, that is a very gratifying part of that. We helped them do this. And so seeing the end result of that, it's very rewarding and very fun.